Hello, Dr. Dan Savarino here from the Apex Center for Regenerative Medicine. Welcome to the first episode of Ask Dr. Dan. I want to thank you all for the questions that we received, and I look forward to doing this with you guys weekly. This week's episode, we were asking you to give us questions about regenerative medicine. We picked 4 questions to answer today, and if you have any other questions, you can certainly email us at info@regenerateng.com or message us on any of our social media. So the first question we received was from Bob M., and that question is, how does regenerative medicine work? So, Bob, there's a couple different ways. It depends on what procedure you are doing. So the type of procedures we normally do in our practice for regenerative medicine are PRP, or platelet-rich plasma, and we do bone marrow stem cells. So PRP, we draw your blood and we concentrate the platelets, and then we inject those platelets into the area of injury. Your platelets have growth factors in them that go into the tissue, and they recruit other cells to come in and bring healing to the area. As far as your stem cells go, stem cells we get from our bone marrow. We get bone marrow from the back of the hip. Those cells, when you put them in that area of injury, they're smart cells and they're attracted to that injury. They send out messengers to all the other cells in the area, and they recruit these cells to come in and repair. The other thing they do is they help recharge the cells in the area by stimulating the energy parts of your cells called your mitochondria. So they get them working and help in the healing process. The second question we have is from Mary D. She asked, what conditions can you use regenerative medicine for? So there's many conditions you can use regenerative medicine for. In our practice, we use it for musculoskeletal conditions. So we use it for things like arthritis. We use it for chronic tendon injuries. We use it for muscle injuries, ligament injuries. It can be used for spine and disc disorders. We also use it in our practice for aesthetics. So you can use PRP for hair regeneration. You can use it for skin rejuvenation. You can do a facelift with PRP, a facial. There's lots of different things you can do for it. Outside of what we use it for, there are also studies with things like stem cells for things like spinal cord injuries, and they're using stem cells in the lab to work on developing organs. So there's a lot of uses that hopefully in the near future will be here, and in our practice, we use it mostly for the musculoskeletal and the aesthetics component, but you can really use your stem cells for a multitude of injuries. They've been using it for cancer for years. It really does a whole lot of different things. And then Pat C asked, how long does it take to see results? So, PRP and stem cells are very similar, I find, in the length of time that it takes for most people. I would say on average, most people will start to notice a difference at about 6 to 8 weeks. That being said, everybody is different. I've had people where I did platelet injections on them, and 2 weeks later they had no more pain. And I've had people where it takes several months for them to feel better. It could easily take 12 weeks or beyond. The other thing with PRP is that it can sometimes take more than one injection. So you can sometimes do 2, 3, or even 4 to get the results you're looking for. But most people will do pretty well with PRP and stem cells. And then the last question is from Mike M. And Mike wants to know, how long do results last? The answer to that, too, is everybody is different, and the conditions are different. So for something like arthritis, you can get very long relief with something like a stem cell injection. Some people will get several years out of it. But because arthritis is a degenerative condition, it is probably going to come back, and you will likely need another injection. Where for something like a chronic tendon injury or a ligament injury, using PRP or stem cells, sometimes that can be permanent where it never comes back. So how long it lasts has a little bit to do with exactly what's being treated, and then everybody's body's different. Your platelets and your stem cells are different from the next person's. So some people it will work a little bit longer, and some people they have to repeat it a little bit sooner. And so those are our questions today. Thank you for taking the time out to listen. Again, if you have any questions you would like to ask, you can email us at info@regenerateenj.com. You can reach out to us on our social media, on Facebook at Apex Center for Regenerative Medicine, on Twitter at regenerateenj.com, and on Instagram at regenerateenj. Like us on all our pages, and you can see what we have going on, all our different procedures, regenerative, minimally invasive, aesthetics. And next week, we will have another subject. Have a great weekend. Looking forward to hearing from you.